Have you ever seen a patient who looks tan without sun exposure, feels extremely weak, and has low blood pressure and crashed during stress? So, this is not normal fatigue. This is Addison disease. So, in this video, we will discuss about Addison disease step by step from hormones to life-threatening adrenal crisis. So, in a way, you will never forget for in an NCLEX exam. So Addison disease, it's not just low cortisol level. So it's a condition where stress can kill the patient. So I will break down Addison disease in a simple nursing language, including causes, symptoms, lab results, treatment, and Addison crisis. So that all are exam oriented. So please make sure you should remember all this for NCLEX exam. It is very important. So, it is a chronic endocrine disorder in which the adrenal cortex is destroyed or not functioning that can lead to deficiency of adrenal hormones, mainly cortisol and aldosterone. So, what is the function of cortisol hormone? It helps with maintenance of blood glucose level. It helps to maintain our blood pressure, and it has anti-inflammatory action. And it also helps the body to handle stress. Whenever our body is in stress, and what the aldosterone does, it retains sodium, water, and excrete potassium. So it also helps in maintaining blood volume and blood pressure. So when there is low cortisol level in our body in case of Addison disease, so when what happen? So it will have hypoglycemia because decrease glucogenesis. Patient may have fatigue, weakness, poor stress response, shock during illness, and increased production of ACTH secretion. So ACTH hormone that is secreted by our pituitary gland, anterior pituitary. So when there is low aldosterone level, it causes sodium loss, patient have dehydration, low blood volume, hypotension, and along with the patient have potassium retention because what does aldosterone do? Aldosterone help to do sodium water retention plus potassium excretion. So when there is low aldosterone level, so there is hyponatremia, there is low volume and potassium excretion. So potassium excretion will be decreases. So there is potassium retention and patient have hyperkalemia and hyponatremia. And apart from that, patient will have salt craving. And along with this high ACTH hormone that cause the melanocyte activate stimulate the melanocyte to produce more melanin, so it can lead to hyperpigmentation. So in this addition, patient will have hyper skin pigmentation. So patient skin color is changes. Patient have bronze color skin. So next is the causes of Addison disease. You can remember mnemonic ADD. So A is autoimmune, most common. So if there is auto means our immune system that destroy the adrenal cortex. It is gradual, permanent damage. Then next is D for disease, any tuberculosis, metastatic cancer, and fungal or HIV infection. These damage during trauma, adrenal hemorrhage, or surgical removal. So that can lead to adrenal crisis and adrenal damage, and it can maybe cause for Addison disease. So next is the sign and symptoms, clinical manifestation. That is very important for NCLEX exam. So first patient is having hypotension. Why hypotension? There is sodium and water loss. Next is hypoglycemia due to low cortisol level. Hyponatremia because there is aldosterone deficiency and fatigue, weight loss. Why? Due to low cortisol level and poor metabolism. Next patient is having hyperkalemia due to increased potassium, due to increased potassium retention, and patient is hyperpigmentation, bronze color skin due to increased production of ACTH. Plus, patient will have salt craving because there is sodium loss in our body. And patient look very thin, weak, tired, dark skin color. So as a trick, you can remember all the symptoms there will be low except potassium. So in this patient will have hyperkalemia, increased potassium level more than 5. And apart from that, other symptoms patient will have only low, like low BP, low weight, low glucose level. There is alopecia, patient will have alopecia, low hair on the their skin. Patient will have low mood, depressed mood, low sodium, low energy. So all that will be low except potassium, and patient will have hyperpigmentation, that is bronze color skin. And due to decreased blood pressure, hypotension, patient may have orthostatic hypotension, dizziness, and due to decreased weight loss, patient have muscle wasting, no obesity. So, and due to sodium loss, patient will have dehydration, salt craving. So treatment for this, in this addition disease, treatment will be lifelong treatment. So patient will be put on hormonal replacement therapy for lifetime. So in this patient will have give steroid as the patient as body have less amount of cortisol level, steroid level. So we will give steroid like hydrocortisone, prednisolone, fluorocortisone. So key nursing teaching for here, it is very important. Always teach the patient to take steroid for lifelong. Never abruptly stop the steroid because it can lead to adenosine adrenal crisis. That is a life-threatening condition. And never skip the medication. So, and always teach the patient, don't believe this medication will cure you permanently because this medicine will prevent you from further deteriorating. So it is a hormone, so you have to take it for lifetime. So that will balance the cortisol level in your body. Apart from that, patient should be taught to take diet high in protein, carbs, and sodium. And monitor daily weight, monitor blood pressure and electrolyte values, and increase the dose of prednisolone or any other cortisone during stress, surgery, and sepsis. Because during stress, the body needs more cortisol. So, but in the additions, patient cannot make cortisol at all. So, normally, when a normal person faces infection, surgery, or trauma, and any severe illness, then our body automatically increase cortisol production. So cortisol during stress maintains blood pressure, it maintains blood glucose and supports heart and blood vessels. It controls inflammation and helps the body to survive during stress. So during stress, there is high cortisol demand. So what happen in Addison disease? So in the Addison disease, there is adrenal glands are destroyed. So no cortisol reserve, so no stress response. So when stress happens, so cortisol demand increase, but there is cortisol in the body supply, there is zero. So there is a mismatch. This mismatch leads to adenosine crisis. So what happened? The blood pressure suddenly extremely drops. So where there is no cortisol, so the blood vessels don't respond to catecholamines, and this can lead to severe hypotension, even shock. So apart from that, the blood sugar also falls. So cortisol mainly increase glucose. So without cortisol, there is hypoglycemia. So brain plus heart, they are also affected. So inflammation that goes out of control because cortisol hormone that controls the inflammation. Without it, there is a severe inflammatory response. So it is happen in sepsis. So it worsen in the sepsis also. And there is electrolyte imbalance also worsen because low aldosterone that can lead to sodium loss and dehydration plus hypotension that worsen very rapidly. So as a final result, patient have additional crisis like shock, patient have shock, confusion, vomiting, hypoglycemia, and death if it is untreated. So why steroid dose must be increased? Because we are replacing the cortisol that the body should have produced. So that's why during fever, during surgery, or during an infection, steroid dose that is doubled or tripled. So in adrenal crisis, there is a sudden drop in blood pressure, 89 by 40 mm of Hg. So there is a normal blood pressure that is 120 by 80. So there is a drop in BP less than 89 by 40 mm of Hg. So first action where here is, so as a nurse, you should always remember. So first is steroid that should be IV pushed for hydrocortisone or prednisolone. So next there are practice questions. The nurse is conducting discharge education with a client newly diagnosed with Addison disease. Which information should be included in the client and family teaching plan? Select all that apply. A. Addison disease. Addison disease will resolve over a week, requiring no treatment. B- Option 2, avoiding stress and maintaining a balanced lifestyle will maintain the risk of for exhibition. Fatigue, weakness, dizziness, and mood changes need to be reported to the healthcare provider. A medical identification bracelet should be worn. Family members need to be informed about the warning signs of adrenal crisis. Dental work or surgery will require adjustment of daily medicine dose. So, what are the correct answers? Correct answers are 2, 3, 4, 5, and 6. So, addition disease, as we have discussed, occurs when the client does not produce enough steroid from the adrenal cortex. So, lifeline steroid replacement is needed. So, if the client should be taught lifestyle management techniques to avoid stress and maintain rest periods, then a medication identification bracelet should be worn, and the family should be taught signs and symptoms of that indicate the impending adrenal crisis, such as fatigue, weakness, dizziness, or mood changes. And dental work, infection, as surgery commonly require an adjustment doses of the steroid to prevent adrenal crisis. So after stabilization of addiction disease, the nurse teach the client about stress management. What should the nurse instruct the client to do? Remove all sources of stress from daily life. To use relaxation techniques such as music, yes, right. Take anti-anxiety drug daily. No, avoid discussing stressful experience. So correct answer is 2. Finding alternative method of dealing with stress, that is good. Relaxation techniques such as music. So it is considered as the stress management therapy. Removing all the source of stress from the life, that is not possible. And anti-anxiety drugs are prescribed for temporary management during the periods of major stress, and they are not an intervention for alternative stress management, and avoiding discussing of stressful situation will not necessarily reduce the stress. So correct answer is to use relaxation techniques such as music. Next, a client newly diagnosed with primary addiction disease ask the nurse about the cause of this disease. So, what should the nurse tell the client? So, this disease is caused by insufficient secretions of growth hormone, no dysfunction of hypothalamic pituitary, idiopathic atrophy of the adrenal gland, and oversecretion of adrenal medulla. So, correct answer is 3 as the idiopathic atrophy of the adrenal gland, because primary addiction disease refer to the problem in the gland itself that result from the idiopathic atrophy of the gland. The process is believed as by autoimmune in the nature. The most common cause of primary adrenocortical insufficiency are autoimmune destruction 70% and the tuberculosis, that is 20%. So insufficient secretion of growth hormone that cause dwarfism or growth delay, and the dysfunction of hypothalamic pituitary, that is the pituitary dysfunction. So it can cause addiction disease, but this is not a primary disease process. So primary disease process involved, that is the problem within the itself with the atrophy of the adrenal glands, and the oversecretion of the adrenal medulla that cause pheochromocytoma. Next question is, which goal is the priority for a client in addiction crisis? Controlling hypertension, preventing irreversible shock, preventing infection, and relieving anxiety. So, what is the correct answer? Option is 2, preventing irreversible shock. Why? So, addiction disease is caused by deficiency of adrenal corticosteroid. So, it can result in severe hypotension and shock because of uncontrolled loss of sodium in the urine and impaired mineralocorticosteroid function. So, this result in a loss of extracellular fluid and dangerously low blood volume, as we have discussed in the starting, that is adrenal crisis. So it is very important to prevent the patient from irreversible shock, so that can lead to death. So next question, what is an expected finding in a client with adrenal crisis during adrenal crisis? Fluid retention, no. Pain, peripheral edema, no. Hunger. So there is no fluid retention and no peripheral edema. So by solving with elimination method, so two options are left, pain and hunger. So correct answer is pain, adrenal hormone deficiency can cause profound physiological changes. So, a client may experience severe pain such as headache, abdominal pain, back pain, or pain in the extremities. So, inhibited glucogenesis commonly produce hypoglycemia, and impaired sodium retention cause decrease or increase full volume. Edema would be not expected, and GI disturbance, including nausea and vomiting, also expected finding in Addison disease, not hunger. So, correct answer is 2, pain. Pain plus nausea, vomiting also can occur during adrenal crisis. Next question. A client with Addison disease is taking corticosteroid replacement therapy. The nurse should instruct the client about which side effect of corticosteroid. Select all that apply. Hyperkalemia, skeletal muscle weakness, mood changes, hypocalcemia, increased susceptibility of infection, and hypotension. So write down this correct answer in the comment box. Next question. The client is receiving an IV infusion of 5% dextrose in a normal saline running at the rate of 120 ml per hour. When hanging the new bag of fluid, the nurse notes swelling and hardness at the infusion site. So, what should the nurse do first? Discontinue the infusion, apply a warm soak at the site, stop the flow of solution temporarily, and irrigate the needle with normal saline. So write down this answer in the comment section and I will put it later. So this is all about Addison disease. So if this video really helped you, please like, share and subscribe Manpreet RN Talks for more NCLEX focus nursing concepts, and so study smart with me and pass NCLEX in a first attempt.